Welcome to the Cerner video training series. Today's video will be focused on outpatient nurses who will both need to manage the patient lists for their practice, both inpatient and outpatient, as well as enter pre-orders for upcoming surgeries, cardiac catheterizations, etc. So our first task at hand will be to show you how to create a patient list. Now, I do have other videos already available on the patient list, but I want to be more specific and focus on your particular needs in the office. So first, I'm going to open up the patient list module by clicking patient list, and then I'm going to click on this wrench icon, and I have this modify patient list dialog box pop up. As you can see here, I actually have 5 lists already created that are in the available list, but they're not in the active list. I want to create a new list, and I'm going to create it by provider group. So for example, let's say I work for Lakeland Surgical. And I'll go and find Lakeland Surgical. And before I click next, I've got a couple more things to do here. First, I want to look at encounter types. Let's say I'm looking at patients who have pre-registered for the hospital. So we keep them on our list. I can just filter by encounter types and select pre-register. For this particular list, I'm not worried about those that are currently in the hospital. So I'll say pre-register. And since pre-registration only exists for patients that are signed up prior to surgery, and as soon as they get admitted, they switch the type over to inpatient or outpatient in a bed or observation, you only have to worry about this one particular type. Now I want to highlight that in the name and say pre-registration, or we can just say pre-reg list. And we can shorten the name up here if we want to. You notice there's other options here as well, but I'll get back to those in a moment. So now I'll say next again. This next button brings you to the proxy window. This is the way you can make this list available for others to see, but that's just for your understanding. I won't deal with that in this particular video. And then I'll say finish. You now see the new list over here on the left hand side. If I want to bring it over to the right side for the available lists, I click that arrow, click OK, and there's my list. This list can be sorted by clicking names or admitting physician or primary care physician. But you may find this list doesn't have all the elements you'd like to have in the columns. So you can always go to this Customize Column button, click on it. You can change the way it is sorted. You can sort it by room or any number of ways. But you can also add to the column. So you can add the admitting physician, or I think that was already there, but you can add consulting, simply moving things over. Primary care physician, I think they're already there as well, but that's how you do it. And then you save it and you exit. So that's a patient list, and this was the pre-reg list. Now let's make a list of patients who are in the hospital for the same group, those that are actually been admitted to the hospital. So I'll click on this icon again. I'll click on New, Provider Group. I'll choose Lakeland Surgical again in this case. This time I'm interested in patients who are only patients that are currently in the hospital. Well, that would represent patients who are inpatient, observation, or outpatient in a bed. And finally, here's this discharge criteria option. I'll click that. And I only display patients that have not been discharged. That will ensure that I'm seeing only patients who are currently in the hospital. And then I can indicate down here And then I can just go and say finish. Actually, I can move both lists over and say OK. I think there was a glitch there, but anyway, you see the lists. And that's how you do the patient list. Now for the second part of this video, I'm going to open up another test patient. You can see I can search for patients up here in this right-hand corner, last name, comma, first name. Or I can also, I've got this in other videos, but I'll show you once again. I can do 3 letters, comma, last name, and then first name, 3 letters. And that'll bring up this list. And I want to make sure that I select the proper patient first and foremost. And then also the proper encounter. So you should see a pre-reg encounter. But here's a tip about Cerner to be aware of. The good news about orders is that it doesn't really matter what encounter number you use. So if I have multiple encounters here, let's say this patient is in Cerner, they're in your office, and you're going to plan surgery on them, and you want to put pre-orders. You do not have to wait for pre-registration to give you a new number or to put them in the system. You can actually just bring up an older encounter and do the orders in a planned state. And the orders will be, when that patient gets admitted, we will find those orders and they will be brought forward to the current encounter number. And that only exists for the orders. So that can be a little confusing, but let me just show you what I'm talking about. So if I had someone who, let's imagine they have multiple encounters, but I don't have a new one for them, and I just bring up an old encounter, probably somebody that's already been discharged, and I go into their chart. Well, now I can go into orders. Here it is, orders and plan of care. I'll say plus, add the orders. And I'm going to say, in this case, SURG is all the surgery power plans. And I will say AM admission, which is going to be probably one of the most commonly used power plans. I have to give a physician name. In this case, I'll just use my own name. Remember, I'm logged in as a nurse. And I'll say co-signature required. We really don't want to use phone or verbal. We don't want to use that if we're doing it from the office. We just want to say co-signature required. That means these orders will flow to the physician's inbox for signature. Now I'll say done. I'll blow this up. And now we're just seeing all the orders. I'm going to clean this up. I'm going to move that menu bar out of the way and get it cleaned up. And now we just run through and make the checks. We can even save it as a favorite. So if our doctor likes to have certain things checked, then we can save it as a favorite. There's a surgical consent. And let's say I'll work through this list. Now you'll see over here this order set, which is entitled Surgery AM Admission. Here it is over here. And it has two other parts to it. It has 2 parts to it under it, pre-admit and day of surgery orders. And they say planned pending. Down here I have the option to sign. If I sign these orders, notice there is no option to initiate. But if I sign them, it says please refresh. Now these orders are in a planned state. When this patient is pre-registered and ultimately comes into AM admission on the day of surgery, the nurses will see this order and then they can bring them up and they'll have the option to initiate the order. The initiation will make them active, but they will not have to call back the physician or the office to ask for orders. The orders are already there. They are already signed. It's just a matter of initiating them once they get to AM admission. So from the clinic, to recap, we'll bring up our orders, our power plan. You notice that, in the case, I'll just bring up another one here. I'll just type in cath, since cardiac cath orders are very common. and we'll find, let's say we're planning an EP study. I'll put my name in again. Co-signature required, since we're doing this from the office. Done. And then I can just enter these orders. If I want to save them as my favorite once I get done, I can click Save as my favorite. And let's say this were, for example, one of our doctors who does EP studies. I can save that. Go ahead and sign. Signing without initiating puts it in a plan state. And notice I don't have an option to initiate. However, if you go over here and accidentally click on one of the individual sets within one of these order sets underneath this cath EP study, like scheduling, suddenly you'll have the option that initiate button will show up. But you really don't want to do that. Just stay in this high level view. Notice you're able to view all of them in one screen, and then sign. And now those orders, it says processing. I will refresh, and you'll see that now that they're planned. But before I show you how to do the favorites, how to go back and access that favorite we saved, let's say you did initiate, or you did sign an order, not initiate, but you signed or initiated an order that you didn't mean to. You can always come back over here and right click and say discontinue, and then sign those. And just to demonstrate again, these surgery AM admission orders, I can do the same thing. Right click, discontinue, discontinue pending. When you sign them, that discontinues the orders, and then when I refresh, those orders disappear. So once again, let's say I'm back in another patient. I'm at my menu bar. I click Add Orders, and now I'm going to use my favorite. Here's that little star, my favorite plans, and hey, there's that cath EP study that we did. I write in my name again. I say co-signature required. Okay, done. And then whatever I'd pre-checked before, or whatever I had changed over here, they're all there, and then I can simply sign. One last thing, if I have not signed the orders, then removing the orders is even easier. Instead of discontinuing, you just right click and say remove, and then they're automatically removed without signing. That's because we never signed the orders to begin with. They never were official. It's like taking a piece of paper and starting to write some orders or check some things, but the doctor never signs it, and we didn't mean to pull that order sheet. We just rip it up and throw it away. No different. So in a nutshell, that's just how you can manage your orders from the clinic and manage your patient lists. That will also make the job much easier when the patient arrives to the hospital. We'll cut through any confusion, cut through the need for phone calls to the office or to the doctor for orders. I think you're going to like that process. If you have any questions, feel free to ask me, Dr. Sanders, or John Watson. We'll be glad to help. Thank you.
Perfect.